Thank you so much. And just as background, I'm a sanitary engineer by background, and then ended up in the slums in the 80s in Peru and learned a little bit the hard way, I think, that it's not about facilities alone. And it's just a couple of years ago, a new Masters of Public Health at the London School of Hygiene and Tropical Medicine, because the evidence base is important and we need to know where we're heading with our programs. And so, but then from the detailed kind of studies and that require intense programming to this COVID outbreak, COVID-19, this pandemic, I think we're all now familiar with it. The scale is as never before. I just checked the figures this morning, and it was now about 2.9 million confirmed cases with over nearly 200,000 deaths, and with the interesting fact that there is 1.3 million confirmed cases in Europe and 1.1 million, about, I mean, rounding off, in the US, and the other regions are far less. I mean, the Mediterranean with 170,000 cases, 144,000 in Western Pacific, and Southeast Asia still very, very low. Africa, 21,000. So they are still later in the curve, and we're all following it day by day. Now, coming to the behavioral question, maybe that was raised just before, we say, okay, what makes a hygiene intervention effective? We talk about hand washing as one of the key, hand washing with soap as one, or sanitizer as one of the key interventions. We know that we need to have knowledge, we need to have motivation, but we also need to have the capability. So the availability of water, hand washing infrastructure, hygiene supplies, time and decision-making powers are all as important. So let me just give a few figures. When we look at the figures of the Joint Monitoring Program, which uses the availability or the presence of a hand washing facility as a proxy indicator, because it's so difficult to, or very costly to get national data on hand washing behavior. We see that 4 in 10 households do not have soap and water on the premises. So that is, we are going worldwide with a message, but 4 out of 10 do not have access to 2 of the essential ingredients. 5 in 10 schools do not have soap and water available to students, and 4 in 10 healthcare facilities do not have soap and water or hand sanitizer at points of care. So that makes that about 3 billion people are without a hand washing station at home, and 900 million school-age children without a hand washing facility in their school. Looking at the pandemic, I mean, schools were closed, kids are going back to school, we're expecting, so what is then the action that we're taking to make sure that that message to stop the transmission and to protect yourself and your others can be put in place? And that is also very important if we consider that there might be a second wave coming up. We all know that the biggest killer of the Spanish flu was in the second wave when it came back the year after. So a very important figure. Now also the inequalities are huge between urban, rural, rich and poor. Here an example from Pakistan, where you can see on the left a vertical, the 17% at national level, 17% of the poorest having access to basic hand wash facilities, and 94 in the richest. But if you then go to the urban area, you see that a little bit more than half of the population have access to facilities. In the rural areas, of the poorest areas, compared to nearly, it's 96% of the richest people in Pakistan have access to hand washing facilities. In the rural areas, the differences are even more striking. So in Central and South Asia, about 22% of the people in urban areas, and then I speak about 153 million people, lack access to hand washing facilities. Nearly 50% of the population in urban Bangladesh, talking here about 29 million people, 20% of the urban Indians, 91 million people. So we're talking about huge figures that make a certain behavior much more challenging than it sounds. Here an example from South Africa. The striking difference between rich and poor is heartbreaking. 4% of the poorest at national level have access to facilities, hand washing facilities, and I mean then hand washing facility, water and soap, and 80% in the richest quintile, and in the urban areas, that's a little bit reflecting the same. And in rural areas, it's very poor overall. Less than one, a little bit about around 1/4 has access. So in sub-Saharan Africa, 63% of the population in urban areas, and here we talk about 258 million people, lack access to hand washing. 47% of South Africans. And what I said, the richest urban dwellers, nearly 12 times more likely to have access to a hand washing facility with water and soap. So those are the striking figures. It tells a story, and I'm just going here. I mean, we know that hand washing is very important. We know that it has been a little bit neglected over the years, although there are programs, and I'll come back to that briefly. But if this is the pyramid from CDC that we found on the website that looks at the pyramid of most effective towards least effective measures to an infection prevention. And then if you look at the personal protective equipment in measuring in effectiveness of stopping the transmission, is lower at the rank than the hand washing, the administrative controls, where you say we have hand hygiene. The top is the social distancing, and luckily that's being applied in many countries and all over the place. But we are a little bit worried sometimes about the positioning of the hand washing message. If you look at the discussions that we're having about the masks, about the rumors, there's so much noise outside that it's very important to remain focused on the agenda. And that's why there are different collaborations happening. There is a new hygiene hub. The London School of Hygiene and Tropical Medicine has created with different partners a hygiene hub to make sure that expertise from the epidemiological, technical and behavioral side can be called in, but also that there can be easily tapping in of expertise from the people at the country level, because that's where all the action's happening. So just a few words about the response to COVID-19. Of course, it is all embedded in the WHO response, that is the Strategic Preparedness and Response Plan, which is centered around 8 pillars. I won't go into that. I assume that most of you are familiar with that, but I just want to highlight that the hand washing activity are fitting in 2 of these pillars. There's one pillar that's called risk communication and community engagement. It deals with the messaging, with the hygiene, with all the rumors and the information that people need. And there's another pillar that is looking at infection prevention and control, which was originally focusing particularly on healthcare centers, which of course is a very important part of the response, but is also with different partners in the WHO, we are really focusing also on the schools, on the public places, on the communities. And that is very important because there is no specific, what we call a water and sanitation element in this COVID response in the pillars. And so you need to look at the response to fit the response into the existing templates and formats. And that took a little bit of negotiation and still remains a little bit of negotiation. And I'm just saying that because one of the key elements in the response is working together and the speed of response. And so collaboration and building on what is there is so important for each of us. So for UNICEF, we did, of course, very quickly use our network and our collaboration with governments to get country response plans. This is already a little bit outdated. I think we have by now all the response plans in place. And we were building on our country WASH programming. So for example, in 2019, we had 88 countries where we had a WASH program. So you see now that with the over 140 countries with response plans and a WASH component in it, you see that this is expanding the number of countries that we're working in. So that means we may push or we may look at impacts and how to support, but that means that, of course, that UNICEF is not going to do that alone in most of the countries, if not all. Apart from collaborating with the governments, it's partnering with every agency and player that can play a role in that context. So, but in 2019, we had 53 countries that supported already community-based hand washing programs, and we had in about nearly 70 countries. We had media-based national hand washing campaigns. So that is, we were building quickly on the response that we were having. As COVID-19 really required a truly global response. We're also dealing, of course, with a lot of countries that have a double burden, and the countries with a humanitarian crisis. In these situations, there is a risk that the host governments and humanitarian communities are not able to immediately deliver life-saving services. And also people in these crises are likely to be more vulnerable as their living conditions already involve poor wash and limited social safeguards. So those countries are getting a priority. So speed is important, and that's where we work in all these countries immediately. We have had webinars with all the regions, with over hundreds every time of participants in that. And last point in the response is, of course, the disruption to markets and supply chains. This is an unprecedented crisis where we're used as UNICEF to work in emergencies. Many agencies, many of you are used to work in emergencies. But this is one where even supplies cannot come into the countries, where if we're not very fast and negotiate with government, water and sanitation people are not considered as essential people because it's a health response. And so, and where markets and supply chains are heavily disrupted, and we have seen that in the surge of prices that we see. So a few words on how we then position in this COVID-19 response the hygiene programs. The first is then the hand washing to prevent human and human transmission. There we work on the messages tailored to the country context with different channels. the access to the infrastructure, particularly in vulnerable communities, the emergency, but also the urban slums, and of course the national coordination building on the existing programs are essential. Maybe a few quick examples. In China, the essential information reached about 44 million people on one of the biggest social media platforms, Sina Weibo. And when schools started to reopen, UNICEF started to work on the messaging and to help people, teachers and students return to schools. And that's now also for all the other countries happening. In Pakistan, there were already strong communication networks in WASH, and a total of 811,000 people were reached with COVID-19 hygiene promotion messages. And the social media platform reached about 7.7 million people with messages. Different staffs were trained. In Rohingya, in Bangladesh, in the crisis area, the radio was one of the major channels, because face-to-face traditional measures are much more difficult, and also the size. But in Rohingya, when we started 2 or 3 years ago with the hygiene promotion, it became obvious that most of the Rohingya people were not able to read, or that there was very little capacity to read written messages. So there, one of the message areas is particularly, the channels is particularly radio. So some of the previous Maryanns, I have to check which Maryann in pronunciation, but said already, context is so important, and we all know that that's true. Just 1 or 2 quick examples more. In Burundi, we had have an innovative partnership with one of the largest soap factories. The 12 million people, only 1/3 was washing hands with soap. And so they had a program already selling 12 million bars of soap per month at a subsidized price. Always difficult to say, okay, are we killing the market? What are we doing right or not? But in this case, it was decided to go for a subsidized price, and by eliminating the VAT and an extra contribution. And now the soap company is switching its existing production line to basic soap, and so get quicker access. This just as an example of thinking other than only the messaging, but also access of soap. In South Africa, there is, together with different UN organizations, funding to utilities for setting up temporary water points and hand washing facilities in townships and informal settlements, and working together on hotspot mapping. So just as a few examples. So to really close the way forward, I mean, what I said already is collaboration, cooperation, really support to the governments, looking at the existing technical hubs and that are there to provide support. There has never been such an willingness to work together, to work with speed and to be as practical as possible. WHO is at the moment working with us and with several others on, it issued already a recommendation for hand hygiene in public places. Now, to give that space, when we think about the 3 billion people that do not have access, and especially in the most vulnerable areas, that requires much more than a messaging approach. It needs a systems approach to hygiene programming. I'm thinking about the previous speaker also. Measuring will be very important. So what are the indicators? How are we going to move to measure success? As I said, focus on the most vulnerable populations, the innovations in hand hygiene hardware. I was just too late to include the IDS companion on hand washing. If people are interested, I can share the link. IDS in Sussex just did a companion of low-cost hand-washing facilities. It's a living document, and it's great help. We are working with our supply division to bring together some guidance on procurement and local devices that can be made together, so that there is some technical support to countries. And then, of course, the last point, the hygiene promotion programs with limited human contact. So not the face-to-face messaging and encouragement, but the embedding of the messages in programs that are different in shape. So I was just recently talking, I think it was with Hans from Rana's recently, that they said, okay, even in communities, we think about with a megaphone to have one person in a community, but from a distance. So there are different ways and different initiatives that people are thinking of to make sure that every person it can be reached for hand washing. There's a lot of documents out. I wish I had been included here, the IDS document, the link to the hygiene hub of London School, and I understand that our colleagues have already shared the WASH bulletins. Several of these tools and resources are available, and we, of course, through the different platforms, will continue to share any existing documentation that is available. Just to highlight, on the left side was the first technical brief, the WASH technical brief that tried to compile the existing evidence related to the transmission of COVID when it comes down to water, to wastewater, and so that might be a useful document. As said, this is a new outbreak, a new pandemic, as we have never experienced before. So all these documents probably will remain some living documents, because we expect an increase in interest, but also an increase in learning, because everybody of us is learning every day. So we hope that in your programs, many of you are in already some related programs. Yeah, let's work together and learn together. Thank you.